Welcome, everybody. I'm so glad to be here. My name is Nancy Popkin. I'm an autism resource specialist with the Autism Society and of North Carolina. And I'm based in Charlotte, but we do have people like me, autism resource specialists all across the state. And I will talk a little bit about what we do later on in this presentation and how we can support you. But Kim Tazard, Director of Family Support here at the Autism Society, is also on with me, and she is going to be manning the Q&A. So if you do have questions, you can pop them in there. She'll interrupt me if it fits in, and if our pacing is good. And if not, we will make sure we follow up and get you answers. So, all right. Well, welcome today. We are going to cover a number of things. We're going to talk about the types of services that exist here in North Carolina for our folks diagnosed with autism spectrum disorder. And I'm going to make sure we talk up a little bit about that eligibility for each of those services. So what would be, how you would access those, how you go about applying for them, as well as how you pay for services. It's really important to talk about how we pay for things. So we're going to cover all of those topics. And when we're considering services for individuals with autism, um, we want to focus on the individual themselves. What are their needs? What services would fulfill and support them in those needs? And what funding sources do they have access to pay for those services that support their needs? So we have all of those different things sort of around that person that we have to consider. Um, Sometimes I think people will contact us and ask whether we, what having a diagnosis entitles you to. And entitlement is something that we don't see too often. There are eligibility criteria that go with everything, funding sources that need to be accessed as well. So those are sort of complications, and that's what we're going to talk about today. So the first thing we're going to consider is what a service is. And so I think about services kind of broadly as something that is going to assist an individual in, acquiring new skills or accessing opportunities in their community. It might support them with their activities of daily living and help them maintain health and well-being. So, these may look really different for a child than they might for an adult. But regardless of the age of the person we're thinking about, it's those needs in that moment of their life that we are considering. So, the skills that they may need to acquire when they are young may be different than when they're teenagers or adults, for instance. The activities of daily living that they need to engage in or the various community access points may change over time from when they're a child to a teenager to an adult. So it's a constantly evolving thing that we are considering, and services may cover all of those. There are many different types of services. There are school services. There are services that can happen in the home. There are services that happen when you're at work. There are therapies that will help with skill acquisition, for instance, like occupational therapy or speech therapy or behavior therapy. And there are supports that may happen in a residential situation to help with that living space, maintaining a living space, and navigating you know, daily living skills. So all of those things would fall under services. Potential services that we're going to talk more about that fall under Medicaid in particular would include something like community living and support, which includes both personal care and sort of in-home skill building support. There's community networking, getting out into the community, whether it's for leisure or for like volunteering and making those connections. day support. Some of our folks may be eligible for and may be in need of support during the day, to have sort of a fulfilled and enriched day. Respite is where somebody is coming and providing, um, essentially babysitting in a way, but giving a primary caregiver a break. So spending time with an individual more in a leisurely fashion so that the person who is the primary caregiver has a break, and can do things for themselves. And then supported employment services are another pretty common service that we see. And that would be for an adult who is working, or is wanting to work, to some extent. Additionally, there are other services that exist. They're not going to be appropriate for every single individual. Um, Everything from assistive technology equipment to um, natural supports education. That would be, for instance, allowing primary care giver to attend a conference and learn more about supporting their child. It can include care management, sometimes home modification, some behavioral supports or residential support. So this is a list of different services. And you can find descriptions of each of these online, with each of the managed care organizations. And I'm going to provide you with a link to your to how to find your managed care organization so you can get more detailed information. But my point here is to let you know that there are a range of services out there. It's not that everybody with autism gets all of them. Um, it's based on needs, and we'll talk about how they determine needs. And then, based on making sure that all the goals of a person's plan are being covered. So how do we determine what support is needed? This is really important, but it usually starts with a psychological assessment and evaluation. Um, and so we really, you get a psychological evaluation or assessment when your child is diagnosed, but it's important over time to redo those evaluations when we're looking at getting services of some sort. So we need up-to-date evaluations in order to consider an individual's needs. For a child, that's usually evaluations within the past 3 years. For an adult, sometimes we can go 5 years out. But we know for those of you who have school-age kids, that within the IEP, the individualized education plan process, um, those evaluations need to at least be considered every 3 years to make sure that the IEP, the individualized education plan, is on track with providing goals and supports for the child's current needs. When we look at services outside of school, private therapists use evaluations to determine what they're working on, and our Medicaid provider services are also using evaluations to make sure that they're providing the services that really are meeting both the goals and the needs of that individual. So this would also include that personal data, knowing what the day-to-day life of the individual is and what their individual goals are. It's important that we are not only thinking about us as parents, and I'm a parent of a 31-year-old with autism. Um, and, you know, I think it's important for us to consider not just what we want for them, but what they want for themselves. What is it that they enjoy doing? What is it that they excel at? What are the things that, when I think about my son, what makes him happy and flappy? Those are things that we want to make sure are part of his life and part of their lives too. And so we want to make sure we're getting supports and services in place to maintain those. So we have to take a look at funding because nothing is free. It may be that there is a funding source that makes it free for you, but somebody is paying for any service that your child, whether they're young, teen, or adult, is getting. So this is a list of where the funding might come from, and it's important to think about what you can access. So private pay is that first one where you pay out of pocket for supports and services. It is the least fun one of all, and it's important to look at the rest of this list and see what else you are eligible for, so that that private pay does end up being that last resort. But it is something that you need to factor in there. Private health insurance um, may cover at least therapies, which is certainly something that is supportive for our folks. And I'll talk about that in a little bit. The schools also get funding for special education services under the Individuals with Disabilities Education Act, or IDEA. And so there is an eligibility criteria for getting an IEP, an individualized education plan, and that outlines the supports and services and goals that a child would be eligible for in school. And that is at no cost to a family. That comes through the funding associated with IDEA. We have entire workshops recorded on our website and toolkits on our website to help you navigate school services if that's something you don't know about yet. And we will talk today a little bit about Medicaid and how we access Medicaid here in North Carolina, and then something called tailored Medicaid waiver. Social Security also is an avenue for some funding. Not everyone will be eligible for Medicaid or Social Security or special education services. And so, for each of these, there are sort of bars set for eligibility and how we access them. So again, we'll talk about those things as we go, but these are things that you're going to want to consider as you're planning to wrap around any individual the services and supports that they need. There are also some state funds that are made available sort of as a last resort for families and individuals who can't access maybe some of these other funding sources. And then some early intervention is also going to be covered through some public health initiatives. The military families have TRICARE and ECHO that covers services as well. So these are all different funding sources. We can dive in a little bit to look at what they look like. So the first thing we're going to talk about are those private pay avenues. And there are two things that I want to talk about. The first is something called Achieving a Better Life Experience Act, or the ABLE Act, that became a federal law in 2014 in North Carolina. We passed our version of it. Every federal law gets a state level law for things like this. And so an ABLE account is essentially similar to a 529 savings account. It is a savings account to be used for an individual with a disability. So it will help the family provide for maybe future funding of expenses, whether it's medical or dental or services. It can be related to housing. It can also be related to just things that the individual will enjoy. But it's a way to start saving that will not negatively impact eligibility to other funding sources. So that's really the key point here. In order to be eligible for an ABLE account, the disability has to have an onset before age 26. And And it's essentially a single account. So an individual with autism would have a single ABLE account, and contributions can be made into the account by anybody. But the total amount that can be put into the account in a given year cannot exceed what the annual gift tax exemption is currently. So this year it is $18,000. That may change next year or the year after. So it's important to pay attention to those changes. I've seen it change a number of times over the past 7 years that it's been in place. So, but this year it's $18,000. And there's a cap on how much can eventually go into that account before something like Social Security or Medicaid would look at those funds as an asset for that individual. So the cap is $100,000. The owner of the account can deposit um, additional funds related to wages on top of that 18,000. So that's actually really nice as well for our folks who are working and are trying to balance things so that they remain eligible for maybe Social Security benefits and Medicaid. Some of their income up to 14,580 right now can go into the ABLE account on top of the 18,000. Now, if a family, if you can put aside $100 or $1,000, a year, that may be worth looking into as well. But that's something that we want to make sure that you know families are aware of, and you can start this as early as your child has a diagnosis. You don't have to wait to a certain age to open an ABLE account. um so that first $100,000 that it's in an ABLE account, Social Security and Medicaid will not look at. And if it exceeds 100,000, then they are starting to look at that. Um, if you had set aside a 529 fund for an individual, and then later on you learn that they're not going to be going to college, maybe that's just not in the cards for them, those funds can be rolled over into the ABLE account, but only like up to that 18,000 annual contribution, or whatever the annual contribution level is. There are a lot more details about ABLE, but you can learn more about them at this website and this phone number if you're interested in setting up an ABLE account. I really think it's important for families to get started if they have the capacity to save for their kids as early as possible. It can make a big difference later on. Another way to set aside private funds for an individual with a disability is something called a special needs or supplemental needs trust. So these, again, are funds that are set aside to provide goods and services to an individual with a disability. Also, the funds in that account will be shielded from Social Security and Medicaid, regardless of how much is in the trust. So for families who are able to, or thinking that they may be able to save or have contributions from other family members that would exceed that $100,000 limit. And I know that is a huge amount of money to think about. But for families who might, a supplemental need or special needs trust would be the way to go. It is important, though, one big difference between an ABLE account and a special needs trust is that with the special needs trust, if some of that money ends up being used for rent or food or clothing in particular, that may count as income for that individual who's getting benefits from Social Security. I believe the food part is going to be taken out next year, and it would only be rent and clothing that would be considered. But again, it's important to do your homework to get the latest information. Um, and that latest information you can probably source from the help of an attorney. You cannot create a special needs trust without the help of an attorney. So you would be engaging legal assistance in order to do that. You do not need an attorney to set up an ABLE account, however. So slightly different things, but still with the same idea of setting aside funds. Um, and I'll tell you, it was probably the best advice that was given to us when my son was young, was to set up a way to save money for him, you know, starting when he was diagnosed at the age of 3. Um, so moving on, we have a lot to cover, so I'm going over things pretty quickly, but health insurance is another funding source. And I say that word as we don't think of it as funding, but it pays for to some degree, both health care, which, many of our kids, whether they're children or adults, have, specialized health needs. And so health insurance is very important. I know my son has epilepsy and has a sleep disorder, so neurology has been a big part of our lives for all of his life, in addition to his primary care physician. Um, and of course, keeping up with health and dental services is really, really important. And so, want to make sure that our folks are getting the health care that they need. But health insurance can also sometimes cover those therapies like speech and occupational therapy, maybe counseling services and behavior therapies. And applied behavioral analysis falls under behavior therapies. I'm going to talk about insurance in a minute right here. Um, so, you know, we had insurance law put in place here in North Carolina that made it so that health plans that fall under the bill's criteria, so these are large group plans based in North Carolina with more than 50 employees. Um, these plans are required to provide it's called adaptive behavioral treatment. So that includes applied behavioral analysis, um, which can be provided by any number of providers now here in North Carolina, but also covers other therapies. Very big here in North Carolina is our teach centers. And so it also covers their services and other therapies and services related to that diagnosis of autism specifically. Again, not every single health insurance policy that you may have will have this criteria applied to it. But it is part of the law if the actual health plan falls under the criteria of the law. So that's very important to keep in mind. It also covers medically necessary treatment. So, occupational therapy, speech, physical therapy, those sorts of things. Pharmacy and whatnot. That coverage in the law says it's available up until the age of 19, with an annual benefit of $40,000. And I know for some families, $40,000 does not cover a full year of applied behavioral analysis. So there still may be co-payments and deductibles that need to be met on that policy. But this is how much the maximum that can be covered. And that can change from year to year. Again, it's important to keep up with that. It's also important to know that while the law sort of says that the services must be covered up to age 19, there are some commercial plans that are covering these services up to age 26, and others for the lifetime, including Medicaid. So that's something else to be aware of as it applies to your health insurance benefit. I mentioned school services as another way to get support and services that's paid for not out of your pocket. So the Individuals with Disabilities Education Act provides criteria for special education services, but not everyone will be eligible for an individualized education plan. Um, the eligibility criteria uh, is very aligned with the Diagnostic and Statistical Manual of Psychiatric Disabilities, um, version 5. And again, we have resources on our website to help you learn more about this if you're not already aware of IEPs. But it can be a really instrumental way to get support and services during those school years, because an IEP covers functional skills as well as academic skills, as long as those functional skills can be tied to instruction and education, which many of them can. Things like social skills and organizational skills, self-regulation, self-advocacy, all of those non-academic skills may have an impact on their education, and therefore can fall under an IEP. So that's an important place to get help and support during those school years. Um, and within special education for kids who are eligible, again, they may be able to get speech or occupational therapy, or physical therapy at school. Again, all of those things, they have to be able to show that functionally they're not able to access the school environment because of deficits in speech or fine motor or sensory, um, or gross motor skills. One note about occupational therapy: while in the private realm, occupational therapy may cover sensory processing needs. In the school setting, the occupational therapist does not provide therapy for sensory needs, only guidance on accommodations related to sensory. But this is an important part of our kids' lives. They can be in school starting at age 3, if they are eligible for an IEP, all the way up to age 22 if they haven't met diploma um, uh, expectations. So for kids who are following extensions of the curriculum. So that's a lot of years, and we want to make sure you're getting as much support out of the schools as possible. Knowing that, again, everything with school is tied to education. So there are limits. It's not meant to be rehabilitative. And then we get to Medicaid. And Medicaid is probably the most complex um, part of thinking about services for individuals on the autism spectrum. I think about Medicaid as being this giant pile of money that is not giant enough, but is divided into buckets. And those buckets each apply to different things. So it is really important to know the buckets and know which ones you can access. So I'll point out that the standard plan Medicaid and tailored Medicaid, or North Carolina Medicaid Direct, are our main Medicaid buckets. And I'm going to talk about each of these buckets individually, but I'm going to point out quickly that the early periodic screening, diagnosis, and treatment bucket actually is attached to both the standard and the tailored Medicaid plans. So we will talk about, again, each of these buckets separately, but I just want to make sure we're really clear that early periodic screening, diagnosis, and treatment, it doesn't matter which bucket you're accessing, you have access to that bucket as long as you can access Medicaid. So the first bucket is this standard plan of Medicaid. And this is our Medicaid that's available based on household income. So this is Medicaid we make available to families who are lower income, cannot afford health insurance otherwise. Since the expansion of Medicaid in December last year, more families have been able to be eligible for standard Medicaid. And so whether you have a disability or not, if you meet that financial requirement, income level for Medicaid, you would get standard Medicaid. These are operated by commercial plans. I think there are 4 or 5 of them across the state, and they include integrated healthcare services. So all of your doctor's visits, emergency care, medication, um, specialty services like therapies and vision care can be included. Some basic behavioral health that falls under mental health and substance use disorders. Again, there's that EPSDT that I mentioned, that early periodic screening, diagnosis, and treatment services is covered if you have Medicaid. That's just standard Medicaid. Um, so you do get those services. Short-term nursing care can also be part of that, as well as non-emergency transport to doctor's appointments and treatments, pharmacy, those sorts of things. That early periodic screening, diagnostic, and treatment bucket is actually really important for those who have Medicaid, especially if they have standard Medicaid, because it is sort of what's going to pay for that diagnostic screening and evaluation. So when kids are really young, 18, 24 months, they're getting screened for autism if they have Medicaid at their pediatricians, and that screening is paid for by this EPSDT bucket. And moving up through the years, up until age 21, it will cover those screenings. It covers the diagnostic evaluations, any behavioral assessments and treatment plans. It also can cover some case management, and it covers those adaptive behavior treatments, therapies, applied behavioral analysis, and such. So, so that's actually a very helpful way for Medicaid to cover these really needed first steps, especially for our families. It is not something you have to apply for. It's just automatically part of Medicaid if you have a standard Medicaid plan. So if somebody has Medicaid and it is discovered that they have a diagnosis of autism spectrum disorder, they are eligible to shift from standard Medicaid bucket to the tailored plan Medicaid bucket. And that shift is important. Those EPSDT services are available in either bucket, but the tailored plan is specifically and only accessible for people with a disability. And so those tailored plans are not managed by those commercial insurance companies, but rather managed by local management entity managed care organizations, or LME-MCOs. That's a mouthful. And so they oversee both the medical needs that standard Medicaid was already covering, plus additional services that are related specifically to intellectual and developmental disability diagnoses. So one of the things that comes with that tailored Medicaid, really important thing, is care management or tailored care management. So this is somebody who's attached to your child, again, regardless of age, who will help you know what you can access, can make some of those calls for you, really providing that support. Care management is provided through the LME MCO. Tailored care management is actually provided through a provider agency. So a different agency would have somebody who would provide it. The big difference is that the tailored care management, for accountability reasons, is really a little more hands-on. They've got to be checking in, talking to you at least monthly, making sure they're aware of the needs and getting support services in place. So that's something to make sure if you shift over to tailored Medicaid that you're shifting into getting either tailored care management or care management with the MCO. Another thing that and I'm going to talk about separately, is 1915I services. So with tailored Medicaid, we open the door to these 1915I services, which are some services you can access as close to immediately as anything immediately happens. It also allows you to access the innovations waiver if you are eligible, big if you are eligible, as well as residential supports through something called like an intermediate care facility or other residential support. There are also substance use and behavioral health services associated with the MCOs and tailored plans that people can access if those are coexisting with a diagnosis of autism. The 1915I services are I put them in a separate bucket because they really are a separate pile of Medicaid dollars that you can only access if you have a tailored plan. Now, some of you may be familiar with the term B3 services. These are replacing B3 services. They're not identical, though there are some services that are similar. And these are an entitlement. So if you have Medicaid and it's tailored Medicaid, so the if applies to the Medicaid, are you meeting the financial requirement for Medicaid? If you are, then you would have the tailored Medicaid, and these become an entitlement. There is an eligibility assessment, but it's not nearly as stringent as the innovations waiver, which I'm going to talk about next. So most of our folks are eligible for 1915I services. And what's important about that is that it includes some respite, which means that families who have Medicaid, excuse me, can access respite when their kid's 5 years old, or 8 years old, or 15 years old, or 28 years old. And that's a really nice thing. It also can include some community living and support services, some community transition support services. So moving from community transitions are really for somebody who might have been in a group situation, moving into a more self-directing situation into the community, and they may need support to get that started. And then supported employment services, and those of course wouldn't start until age 16, but they go up. These are not as comprehensive as the innovations waiver services, which I will discuss, but they're not nothing. And it's really important for families to access these. The Autism Society of North Carolina has a wonderful blog article on 1915I about applying for them and what they will cover in a lot more detail. But just know that if your loved one has Medicaid and it's tailored Medicaid, if they're not getting 1915I services, then go ahead and contact your MCO and get that started. One thing I didn't mention is that while many of our kids, when they're children living with us, are not eligible, because maybe parents are working to the point that they're not eligible for Medicaid, when they turn 18, Medicaid's going to look at their household income as just theirs. They're not going to look at the parent's income anymore. And so at the age of 18, most of our kids will be eligible for Medicaid. And so that means that they can get Medicaid at age 18, and then they can get 1950 I services in place, with some speed. It's not going to be like, one and done in a month, but you can get the ball rolling and get things started. There's not a waiting list for any of these. People hear a lot about waiting lists. And then there's the Medicaid or Innovations Waiver, um, otherwise known as North Carolina's Home and Community-Based Service Waiver. Every state has a home and community-based service waiver, Medicaid dollars that are specifically meant to provide comprehensive long-term supports in the home and in the community. Every state does their waiver differently. In North Carolina, the waiver covers respite care and community living and support, community networking, employment support, supported living, residential services, and some of those other services that I had on that previous slide. Again, based on that individual's needs, which is based on assessments. So you don't just walk in and ask for stuff. But uh, but that in North Carolina, that is what we're talking about when we talk about the innovations waiver. So it is a very, goal-driven process. So it is meant to really focus on, having that individual live a fulfilling life where they are participating to the fullest extent possible, but also to make sure that, we're providing the highest level of service for folks who may not be able to safely or independently live in their community, and who would need to be in a care facility. So the idea of the innovations waiver is really to support them to so they don't need to move into a care facility, but instead to be able to stay in the home with the family and in the community. Again, those services are provided both in the home and in the community. It is called a waiver because it only looks at that individual's income. So, if an individual with autism were to get the innovations waiver when they are still under the age of 18, when the family gets a slot, the application for Medicaid would be just based on the child's income. And that's why we have those trusts and things. So there's not assets in their name or the ABLE account. So that even if if the parents make too much money to qualify for Medicaid and they're under 18, that waives that household income requirement, looking just at the individual. Of course, if they're not getting the slot until after age 18, then they are looking at them as an adult. And to determine what supports and services they would get once they get a slot, they use something called a supports intensity scale. So this is an assessment that allows them to really almost quantify the needs, and then they match it to a budget. There are different tiers within the innovations waiver of service based on your SIS scores, and that will determine what services you get and how much. So some people may get the innovations waiver and they get 15 hours a week of services, and there are some individuals based on the SIS who get 65 hours a week of services. Again, it's based on that supports intensity scale and the needs of the individual. We don't just waltz in and say this is what we want. So it will vary from person to person. Having a diagnosis of autism doesn't guarantee that you will be eligible for the innovations waiver. This is really important. A lot of our folks are not eligible for the innovations waiver. They have some wonderful independent living skills and self-advocacy skills already. They still need support, but not to the level that the innovations waiver was meant to cover. But that's where those 1915I services are really, really helpful and critical. So please pay attention to that. The criteria for figuring out if somebody's eligible for the innovations waiver is if they have what are called substantial functional limitations in 3 or more areas of life activities. So that's self-care, understanding and use of language, learning, mobility, self-direction, and capacity for independent living. So that's something to keep in mind. If you are applying for the innovations waiver, and your child is 3 years old or 6 years old, we may not know the answer to those questions. So they're going to do the best to determine if they might be eligible, down the line based on the current data. Um, and they will be putting them on the registry of unmet needs. So when we apply, we contact the LME MCO. We provide a recent diagnostic evaluation sometime within the past 3 years. And they will want the original diagnosis plus something that's more current if it's been more than 3 years since the original diagnosis. And you're applying to get on the registry of unmet needs. That's the waiting list. And if you haven't heard this before, the Registry of Unmet Needs in North Carolina is extraordinarily long. So if you are listening to me today and you haven't gotten your child on the Registry of Unmet Needs, get them on that waiting list now, because there are over 17,000 people in North Carolina on the waiting list. And it is on average about a dozen years before we actually get one of those innovations waiver slots. It varies by county to county. So that's something that it's very important to do. Again, getting those 1915I services, if you're eligible for Medicaid, you do not need to be eligible for Medicaid to get on the registry of unmet needs. And I can't emphasize that more. Everybody who is eligible should get on the registry of unmet needs. If you're not sure if your loved one is eligible, apply and find out. Don't make a decision, I think mine won't be eligible. Apply and find out. We would rather you do that. And if you disagree with them deciding that they're not eligible, you can file an appeal. Please do that. The North Carolina Department of Health and Human Services has a website called Inclusion Connects that sort of walks you through applying and the different steps as well. A great resource on the internet. To find your managed care organization, please consult this website on the NCDHHS page, where you can see there are 4 managed care organizations, LME MCOs, based on counties. So, this map is a little hard to read, but on the website, you can find yours. Just back up a little bit just to compare Medicaid versus Medicaid waiver. But for Medicaid itself, whether you're applying to get Medicaid, standard or tailored plan, that is actually done through the Department of Social Services. They have 4 different ways you can apply: online, in person, by phone, by mail. Check out their website. To get that information. The innovations waiver itself, that you apply for with the managed care organization, that LME MCO for your county. So that's that previous page. And once they're determined to be eligible, they're on that registry of unmet needs waiting for a slot. So those waiver slots are managed on a first come, first serve basis. So once you apply, you get a start date for being on the registry of unmet needs. You hold on to the letter that says your start date. It's very important to keep track of.
Nancy, can you
Yes.
go back one slide?
Yes.
Just wanted to point out something where Nancy talked about the Department of Social Services is managing those. We've had a couple cases lately where they ask for the income of the household. And it's really because the individual didn't understand at DSS that this is for the innovations waiver. So I want everybody listening, if that happens to you when you go to apply, just know you are only need to talk about the income of your loved one, which we hope isn't anything. You do not have to
Well,
give your full household income. It's not what it's based on. It's
so
based on that individual's income.
so Kim,
Yeah,
I'm going to piggyback on that. So you're talking about though, once they get that waiver slot, they have to apply for Medicaid, and in that case, they're applying for just that individual,
correct.
right? So,
But a
and
lot of our workers that are out there, just due to a lot of turnover, a lot of change, they're sending the paperwork for the full household income.
right,
And
for children,
yeah, and
yeah,
it's not, you just want to, they just need the information based on that child's income.
right.
So, and we
If
can support you. Nancy will tell you
Yeah, I'll show you
that
how to
later.
get
Yeah,
our support with that. If you are applying for Medicaid, before the individuals on the registry of unmet needs, or while they're still on that registry of unmet needs, that is, if they're under 18, they're still going to look at the family income there. It's only once you've gotten that slot that the application for Medicaid, this is very confusing. But that they're only going to look at, because now the waivers associated with that application, they will only look at that individual's income. Um, so Social Security is another avenue for funding. A little bit different in that it's not attached to services, but actually is a check that comes to an individual through what's called the supplemental security income. Um, Social Security also has something called Social Security disability insurance. That's not what we're talking about today. We're talking about the supplemental security income. So this is for an individual who maybe because of their disability is not able to work to the fullest extent possible. So it's due to this lifelong disability. For adults, they're going to look at the income of that individual. So if they are working, but maybe, like my son works 8 hours a week, his wages and his assets, that's what they're looking at. What are his expenses? What does he get? Does he get anything from us that goes into that we call in-kind income? But that's what they're going to be looking at to determine their financial ability. It has to be less than $2,000 on a monthly basis to add up. Um, and and it will include Medicaid once they get the SSI. That monthly benefit that they do get, they're going to look at their total income to determine if they get the full amount, which is somewhere around 900 some dollars right now, or if they're getting less. So if they're getting, they have some income, so they don't necessarily, if for instance, like if they are living at home, not paying rent or paying for food, they will factor in $334 and deduct that from that monthly check because they're getting that from their parents instead. And so their monthly check may be smaller. For children, they are going to look at the parents' income and assets. There are some families, though, who will qualify for their child to get SSI, to get that monthly check from Social Security. And it would provide Medicaid in addition as well. But again, you have to meet that income level as a family if you're applying on behalf of a child. So most of our folks at age 18, they can now apply as an adult, and they should. Social Security often will deny that first application. Please appeal and see if you can force the issue. We have heard Social Security recently really requiring that we justify that a person cannot work or cannot work to the fullest extent possible to be able to support themselves. They're looking at that employment ability. And so if somebody hasn't ever tried working, they're likely to going to get denied SSI until they try. So this is the website for applying for supplemental security income. And then the last agency resource I want to mention is the Employment and Independence for People with Disabilities, a division of the Department of Health and Human Services. used to be called vocational rehabilitation, but they provide employment supports to individuals, and they can do everything from helping with the job search, interviewing skills, to learning their new job and maintaining a job. And they can be accessed as early as 16 years old. The eligibility criteria are not nearly as stringent as the innovations waiver might be. So most of our folks are eligible for services through EIPD, but they have to have a physical or psychiatric or intellectual disability to access those. My son is getting his employment supports through EIPD right now, or EIPD funding. Um, and so you contact, I have the VR still in here, but you would contact EIPD, your local office, um, to apply and get that started. And their website is at the bottom of this page, but this is just a list of the different kinds of things that they can provide. They don't pay for college or vocational training just because, but if it is tied to a specific job, so like a certificate program, they will pay for those classes. So if they're not paying for 4-year degrees or anything like that. So don't get too excited there. But these are all things that, may be, again, tied to employment. We have to tie it to employment, that they may provide support and services for. But the on the job training and coaching is really the big one. They do diagnostic services, though, if you think that, or those evaluations in order to determine eligibility. We've had that done. So that brings us back to where we started. We have to think about that individual with autism. We need to think about their needs. We need to think about what providers of services they can access and what funding sources they can access. So all of those things, we can't think about any of them in a silo. Everything kind of goes together and gives us that full picture of what services is going to look like for an individual. As parents, I can tell you that even if you have a care manager, you're still going to be your own case manager for your kid as well. So educating yourself on your child's diagnosis and teaching, how to teach them new skills is going to be important. Setting goals for new skills at home is going to be important. We're always looking for that, like, what's the next thing we can do to create greater independence? You want to stay in contact with the managed care organization or your care coordinator or care manager over time. Of course, if you're working with a provider agency, whether it's therapy or a provider services, making sure that, the goals are things that you're aware of, that you can work on them too. It's important to be organized and keep track of documents, whether they're digital or paper, but have them in a centralized location so you can put your hands on them easily. And also document all conversations that you have. Make a record. If you've made calls to Social Security because you're going through an appeal, maybe with SSI, know what dates you called or who you emailed. Managed care organization or providers, anybody you're working with, having a paper trail to keep track of things is always helpful so you can refer back to it. The other thing is that, sometimes we have a goal for our kid. We're trying to get from point A to point B, but there may be more than one way to get there. And that's where we come in as autism resource specialists. Sometimes parents call us and say, this is what we're looking for. And I'm like, well, that may be hard to get there that way, but maybe we can go about it this way. And so that's something that we're here to help with. I'll show you how to reach us. But, if you apply for something and you really feel like that a denial was unwarranted, file an appeal, but pay attention to the deadlines. You usually just get like 60 days to file an appeal. So stay on top of that. Contact us, your autism resource specialist, to figure out if there are other ways to access resources or fulfill needs of your kid. And then contacting your representatives in Raleigh to make sure that they know your story and your situation, especially if things are hard to access. When things are out of reach, that's something you need to do. And we have a toolkit on our website to guide you through how to contact your legislators, but they're the ones that are passing laws and legislation that impact access to Medicaid, impact the amount of slots that are available for the innovations waiver, impact the amount of funding that goes toward employment and independence for people with disabilities. So school services, class sizes, all sorts of things. So your legislators really need to know your story and what your needs are, especially if they're not being met. Um, Autism Society of North Carolina has all sorts of great resources on our website. If you go to our website and click on the Gain Knowledge drop-down menu, you will find a link to our Accessing Services page, which goes over all the Social Security and Medicaid things again. And I would encourage you to go visit that now and reread it based on what I just explained today. Our toolkits cover things like IEPs and residential supports and more. I know we have one on guardianship. We also have a webinar library where we have all sorts of webinars on a range of topics. These are just a few related to things I talked about today, but we also have other webinars that are related to other topics. So you can visit those. Couple other additional resources to know about: the North Carolina Medicaid Ombudsman for Medicaid questions, disability rights. And then the North Carolina Client Assistance Program is for those who are associated with the employment and individuals with or independence for people with disabilities department, getting them services. And this is us. We are all parents of someone with autism. There are about a dozen of us across the state. We all manage like a number of counties, but we are here to answer your questions, your very individual questions. And if you go to our website, you can complete a talk with a specialist form. It will go to your autism resource specialists, and one of us will get in touch with you and set up some time to talk, answer your questions, and make sure you know exactly what applies to your situation, your child. And I know that
Wonderful.
was a lot, and you probably have more questions than when you started, but I hopefully at least I've put those ideas into your head of what things you need to be thinking about, and then we can support you individually with making sure that you're accessing everything that you're eligible for.